So, hi folks, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course,
We haven't
Bob.
done one of these for a while, Brad. How to safely perform the Epley maneuver at home for BPPV.
Yes.
BPPV.
Benign proximal positional vertigo.
Yeah. Yep. I thought I threw an extra P in there, but we want to keep it safe. But it's also called the Canalith Repositioning procedure.
Or CRP.
Or CRP, yeah. We got lots of initials.
Yes, we do. And there's a couple really important things that you need to know so you can go through this safely. And we're going to go through these on this video. So
stay tuned.
Yeah, and get your note papers out. You know, write a couple notes.
All right. If you are new to our channel, please take a second to subscribe to us. We provide videos how to stay healthy, fit, pain-free when we upload every day. Also, we've got a big lineup here today, don't we, Brad?
Oh, yeah, different colors, too.
We want to make sure you join us on Instagram now, because we're at official Bob and Brad.
Right.
We're also at Facebook, Bob and Brad. We're also at Twitter.
Oh, my goodness.
And we're also got our website.
We're all over the place.
We're everywhere.
It's kind of scary, Bob, but that's the way life goes.
We're omnipotent.
So the Epley maneuver, do you know that Dr. Epley started this in 1980?
I did not know that.
It was his first time he presented it to a group of doctors, and they all poo-pooed it. They said,
as they always do.
Yeah, they're just treat it with medication.
The pioneers get the arrows.
Right. 2001, it took them 21 years before it became officially accepted into the medical.
Kidding.
Yeah, so it's been going on now for about 17 years, and it's an excellent maneuver if you've got BPPV.
So that's a type of vertigo, most common type of vertigo.
Right.
And, you know, when you get the dizziness or the spinning. And what's nice about this maneuver, when it is the problem, it really works well.
Right.
I mean,
right.
We did it on a live patient that one time.
Right, and that video is out there.
Yeah.
So you can check that out as well. One thing we do recommend, if you want to do this safely, I would see a clinician, a trained therapist that knows how to do it, and have them do it to you. And I myself, when I do it to a patient and I feel that the patient understands it, is very alert and able to do it, I say you can do this at home after we go through it. And then this video is a good reminder to watch and see to make sure in case you forgot something.
Right. And the thing is, you can do it more than once. So a lot of times at my first session, I might do it 3-4 times.
Right.
And then, like you said, sometimes it doesn't quite hold, and you may need to do it again in a couple days, or maybe if it comes back, you can do it again on your own in a month.
Exactly.
You know,
one thing you want to do, though, any clinician will do, is get a history. What provokes the symptoms? What makes you dizzy? And there's 4 questions. If you answer yes to them, I'm not going to go through them all, but it has to do with movement. We have a video that just came out. We put out a week ago, approximately a week ago.
Yeah. Do you remember what it was titled?
If you answer yes to these 4 questions, you
might have BPPV.
Right, so something of that nature.
Yeah, look that up on Bob and Brad.
Right. If you look up Epley maneuver with Bob and Brad, it'll be one of the videos that come up. So if those answers are yes, then you want to perform the Epley maneuver. But there's one important test that you should do, Bob.
Yes.
And that's the vertebral artery test, and this is a modified vertebral artery.
Now, the vertebral arteries are the 2 main arteries in the back of your head.
Right.
I think they provide like 30% of your
It's something like that. They go up to the circle, Willis, whatever. It provides your brain with blood. It's really important.
So do the carotids, but those are 2 that come from the back.
And these 2, if you have compromised arteries back there, in other words, they're not fully healthy, you need to test it. Very simple test, and if your therapist, should do this to you before they do the Epley maneuver, and it's very simple. And this is a modified test. That's why it's called that. The way you do it, and there's more than one way to do it, but the way I like to do it: elbows on the knees, on the chin, and this is going to extend your neck, and then you rotate 45 degrees. Okay, and you're going to hold that for about 30 seconds, maybe a little more than that. But someone has to be looking at your eyes. The clinician is looking at your eyes and looking for some symptoms that they're trained for.
You would probably feel symptoms, too. Wouldn't you say, Brad? You might feel a little bit dizziness.
Right, and you'll see things shaking because your eyes may get some nystagmus. And you want to do that to the right and to the left. It's an important test that should be done. It's rare that it's positive. Usually it's negative, and that gives you the green light to continue on with the Epley maneuver.
I've seen it where, Brad, people had their carotid arteries were like 98% occluded and 100% occluded.
Sure.
and they were getting enough circulation from the vertebral arteries, and it was
Right.
going up through the circle of Willis that they were actually still functioning.
So with an
Yeah.
older person that may have that,
Yeah.
that could be a cause.
Right.
All right. So the next thing we do, all those tests are passed. We want to start the procedure, and we're actually going to get Liz, our camera person.
Yeah, because Liz is a lot better to look at than I am, and I tell you, you know, people want to break from this sometimes,
Right.
you know. So
Yeah,
I'm going to be the camera person.
You get out of here. So
Yeah.
if the camera's shaking around, that's Bob's
Yeah, that's right.
responsibility.
Bad maneuvers. Hello.
You don't have to show them a close up of that mug, Bob. Well, say hi first, Liz.
Oh,
well,
that's right.
right.
They can't hear. Seen but not heard.
All right. There's a couple ways you can do this. You can put a pillow. Why don't you lay on your back now, like this? So the head actually has to extend back and rotate. You don't have any symptoms, do you? I never have. So, you know, this wouldn't be exactly how you do it because Liz has no symptoms. Why don't you get up, though? I don't like to use the pillow. So I like to go off the edge of the bed. It just works better for me.
So either way, you can extend the head using either the pillow or off the edge of the bed.
Exactly. So. Okay, so sit up first. I call this the long sitting position. You're going to have the person in the long sitting, and you have to first do the Dix-Hallpike maneuver.
Right.
And you're going to do that to determine if you have it and which side you're going to start on. I'm not going to spend a lot of time. You can do this facing from the front, holding the head, or I like to do it from behind because I don't have to bend over and stretch my back.
I do, yeah.
So it's here, and we're going to go 45 to the left and back quickly. Yeah. And actually, I have to have her position so her head is back. So why don't you come back?
Yeah, you come back fairly rapidly while you're doing that.
Right.
And then you bring your head right off the edge.
Yep. Now, I'm going to be looking for nystagmus or eye movement. And whether the eyes twitch down or whether they twitch up is going to help determine or analyze which canal is the problem.
Given the problem.
I'm not going to get into that detail too much here. Yeah. Let's do it. To
the right now.
To the right. Okay, and we come back.
See, that's more like it. Now he showed the real-time speed of how you should do it, and you see her head is turned to the right 45 degrees, and it's also extended a little bit.
And now I'm just going to say she's twitching her head. Her eyes are twitching, and they're going up. So that means the posterior canal, which happens to be the majority of problems with the Epley maneuver. Now, if I was doing this in the clinic, I would have my stool back here, and I have another person help me. I don't have to do that, but it's easier.
I usually do too. I have someone help me because a lot of times it's elderly people, and I want to make sure somebody doesn't fall off the bed. Or
if they get ill, they start feeling ill and they need to vomit. You can help
with a container real quick.
Yeah, exactly. So let's go back to this position. Now, after go ahead. We're going to go back. Now, at this position, Liz, you might be feeling really ill, and you might be like wanting to get back up, holding onto the table like the earth is shaking.
So you've started the maneuver now, Brad.
And at this position, if it's positive and it's up and it's a posterior canal, I'm going to stay right here and continue with the procedure, so I don't have to start all over again.
Oh, I see. So you're doing the test, and you went right into the procedure because you found out that was positive.
It was positive because, like I said, this happens a majority of the time. I wouldn't stop and go back up and do it over because of a technicality. I don't want to put the person through that uncomfortableness again. And we're going to stay here, and I'm going to calm her down and say, it's okay, I can treat you, things are going to go well. And after about 20 to 30 seconds, typically, the dizziness starts to go away, her nystagmus clears up, and then, Liz, how do you feel now? Good. At that point, now different clinicians do this differently. I'm going to stay for an additional 30 seconds.
Really?
Yep, just to make sure the crystals are in there. And then we're going to rotate while the neck is extended. We're going to do this kind of slowly. Better slow than fast, I like. And
so the neck is still extended.
Yep.
But he's taking it to the opposite 45
there
degrees
you go.
now.
Yep. And I'm going to, did you feel... Typically, the person will feel a little bit dizzy. You never had vertigo, so you can't explain that. But usually, through that position, the dizziness will come back. Usually, I find it's not as bad as that first one.
The first one's the worst. Right.
And then again, typically within 30 seconds or so, the dizziness and the symptoms clear up. And when they clear up, she tells me, does it feel good, Liz? Yep, I'm going to hold another 30 seconds. Now we're going to rotate to your left side. Okay? So you're going to go on your left side.
And this is where I like to have the second person because sometimes I'm afraid they're going to rotate right off the bed.
Yeah, right.
So
What I usually do is I literally go through the positions with myself.
Right, that's
first.
what I
I
often
say,
do
this
too.
This is what we're going to do, and so there's no big surprises. Now she's going to turn her head and look down. The position of the body is really not critical.
Yeah, it's all about the head.
Right, all about the head. And once again, I'm going to be actually down here looking at her eyes, talking to her, and then you know, you feel a little dizzy, and then you know, usually by this time it's not as bad, although it could be.
If it's working, it usually isn't as bad.
Yeah.
By now.
And then at that point, now bring your, and the same procedure. Wait till it clears up. Wait 30 seconds. Can you pull your knees forward so you're in a? She's a therapist, so she knows 90-degree hip flexion, 90-degree knee flexion. Pull your feet forward off the table. There. And now I'm going to continue to hold on to her head. Bring your chin towards your chest. Hold it there. How you doing? And at this point, sometimes, I don't know, Bob, in your experience, what have you had, but usually they get dizzy here too. And the same thing, but the first one is typically by far the worst.
Yeah. Right.
And we go through the same procedure with that. Slowly bring the head up. There we go. Now at this point, after she clears up, given instructions, you need to keep your head vertical for, 20 years ago, about 15, 20 years ago when I first started this, it was for 48 hours you had to keep your head up and sleep in a recliner. And now after years of doing this more.
Oh, where did Liz go?
Well, she's doing her job because someone wasn't.
Someone wasn't doing their job.
So once the patient is up and they're clear, then the instructions are you need to keep your head vertical.
Yeah, you can look down with your eyes, but you don't want to look down with your head.
Right.
That's what I tell people.
Because that can re-agitate the symptoms and you have to start all over again.
But you're right. I've looked up the studies on this too, Brad, actually, and different people are saying different things. Like you said, it used to be for 48 hours.
Yeah, you had to sleep in a recliner with it tipped up as far as possible.
And we had them wear a neck collar.
Yep, I'll still do that just so they remind them a soft Velcro neck collar.
Well, you know what I do, Brad?
What?
Well, you keep talking, but I'll get mine ready. But
right, and now instead of 48 hours, it's pretty well accepted that if you do it in the AM, just keep your head up until you go to bed that night, and then you're clear.
Well, then additional thing I read is that night, sleep with 2 pillows underneath your head.
Oh, I see. To keep your head.
Just that one night.
Right.
But what I do, because, to get a neck collar for everybody, I just take a pillowcase.
Sure.
And I fold it in fours, like, in 4 pieces like this, and then I just go around like this. And it's enough to remind them.
Yep.
You know what I mean? That's all they need is a reminder.
Right.
And it still stops them a little bit from going down.
Yep. But you're right. If they just remember, because if you're thinking of something else, then you bend over to pick, to tie your shoe or something, you can throw off the whole procedure. Right. And then you got to start over again.
Yeah. So it's not as critical as it used to be, but now that's what they are still recommending.
So that's it in a nutshell. It's simple, but there's some simple things that need to be done. So you can do it at home, but again, remember what we talked about. You should do it after seeing a clinician and get the little things tidied up.
All right. Thanks for watching.